You want to know what real life nursing is all about? This is the Daily Round Show by NRSNG.com.
Hey guys, what's up? It's Susan with NRSNG. I just finished my shift in the ER and I wanted to talk to you all a little bit about what in the heck an ER nurse does, what their focus is, what their goal is, and how they achieve those goals. So the focus for the ER nurse is to make sure that the patients are stable. That's the focus. Our goal is to get them into our care and stable as quickly as possible, and to you, the floor nurses or whoever it is, up to the floor as quickly as possible. The ER, it's all about time. It's all about being quick and it's all about being focused. So if a patient comes in with chest pain, let's say, I may ask them about, the last time they had a bowel movement, but it's certainly not the focus. And if I'm doing an ER nurse to ER nurse report, I'm not going to add in that they had a bowel movement today and it was formed and normal. I'm not going to do that. I might assess that if, especially if it's chest pain, because I want to assess all of the organs and everything. But what I'm giving to that nurse is what's pertinent. So it'd be pertinent to say, this patient came in with chest pain. Their troponins are negative. Their EKG was normal sinus rhythm. They are alert and oriented ×4. They're ambulatory. They're going to be going to the floor for a stress test. Their NPO after midnight. Boom. Report. That's all you should have to know. Once they come up to the floor, if I were to give that kind of a report to a floor nurse, they would lose their mind. But let's say, because I feel like that's how a report should be, the floor nurse should then receive the patient and say, okay, I'm going to be spending a lot of time with you, so now I need to know the specifics of your daily routines, your medications that you take every day. I need to peek over your skin and look in detail at your skin. An ER nurse, it doesn't change the stability of a patient if I look between the cracks in their toes or if I checked their heels. None of that is necessarily pertinent to an ER nurse's job. So when receiving a report from an ER nurse, it would be helpful for you to understand that they aren't looking at that. Not because it's not a great thing for the patient to have a thorough, very intense assessment. I feel like all patients should have that, absolutely. In the ER, I feel like the main thing that needs to happen from ER nurses is that they make that patient stable. So I'm not trying to assess a bump or a cut that they had on their leg or something like that if they're in a heart attack. That's just not my focus. My focus is to stop the heart attack or to, stabilize the patient. So I wanted to gripe about that a little bit. I wanted to talk about the focus of an ER nurse because I do feel like there's a misconception between what we do and how much we know about our patients. But on the floor, you will be spending a lot more time with the patient. You will be getting into a routine with the patient. So you'll tend to know a little bit more different things. On the other hand, I know like everybody gets all sorts about admits because there's a lot of things involved in that. I can see multiple patients in a day. It isn't just that I've been sitting with this patient for the past 12 hours and now I'm going to call a report to you and have you take over from my patient. It's I've probably seen this patient for the past hour, maybe two, and they're now ready to come up to the floor because they're stable, and I've chatted with them long enough to find out the pertinent information from them, and I'm going to be sending them now to your floor where you're going to do the intense, detailed assessment. So try very hard, you guys, to understand the purpose of an ER nurse and the purpose of rapport between an ER nurse and a floor nurse and the purpose of the floor nurse. So it'd be like calling a dialysis nurse and asking them which cream you should use on a patient's bed ulcer. That dialysis nurse probably doesn't know the answer for you. You should call a wound care nurse who would know the answer for you. Or like, what heart medication should you give that patient? Again, dialysis nurse is probably not the patient or the correct person for you to be calling for that information. So an ER nurse is probably not going to know the answers to how the bottoms of their feet look or what their bum looks like if it's not pertinent. If I don't need to look at their butt, I'm not going to look at their butt, because I am trying to get a very fast, safe process going through and make sure that patient is as stable as they possibly can be. So I hope this clarifies and clears up a little bit of issues that I have heard and experienced, especially when giving report to the floor nurses who are always asking me questions that you can look up in the chart. I would love it if you guys would just look it up in the chart instead of asking me to dig through patients' charts when I have already seen multiple patients and you have time up there to look up some stuff. Or even if you don't, you can, ask the patient or whatever. But if that's something that you really need to know the answer to. But anyways, I hope that clarifies some stuff for you guys. Be kind to your ER nurses, because when poo hits the fan, that's who you want there, because they know what they're doing and they're going to be calm, cool, collect, and they're going to get the job done quickly. They're good under stress. So don't hate too much on the ER nurses. We're just different. We have a different focus than the floor nurses. All right. I still love you all, even if you're floor nurses or you're any other kind of nurse, because nurses rock. So love y'all. See you next week.